Are you suffering with numb, burning feet? Are your feet aching? Does the first step every morning lead to pain, loss of balance? Well, this video is for you. So today we're going to talk about what you can do to help yourself. We're going to talk primarily about 7 lifestyle factors that can help reverse the numbness, the burning, the aching, the pain. And we're going to do that right now. So remember, neuropathy deals with damaged nerves in your feet. And so some people have numbness, some people have burning, some people have cold, some people alternate between hot and cold, some people lose their balance, some people lose their strength. So what we want to do is stop the degeneration and start the regeneration. So if you're having trouble with those neuropathy symptoms, chances are you probably have not addressed all of the factors that influence how the nerves function and heal. It's not your fault. No one's ever laid it out for you. So today I'm going to lay out 7 factors that you can do to help yourself. And these are the same things that I do in my office when I work with neuropathy patients. And if you stay to the end of the video, you're going to see one of my patients, how she suffered horribly for over a year with severe leg and foot pain, and now she's doing great. So again, if you want to help your body heal itself, pay close attention, and we're going to share with you some simple lifestyle factors that can help reverse the coldness, the numbness, the burning, and those achy toes. I'm Dr. Gregory Kramer. I'm a doctor of chiropractor here in Livonia, Michigan. I've been practicing for over 30 years, and I specialize in helping people with chronic problems, chronic neuropathy where they have numb, burning feet, chronic spinal problems where they have bulges, herniations, and I use a variety of methods, but basically I look at you 3 different ways. I'm going to look at you structurally. Is there something out of alignment, pinching a nerve that's affecting your feet? I'm going to look at you metabolically. We look at nutrition. We look at what you eat. We look at supplements that can help those nerves regenerate and drive blood to the area. And then we look at you neurologically. What can we do? What can you do in the office, and what can we do at home to help those nerves regenerate and recalibrate? Now, before we go to the main content, please like and share this video. If you know someone that's having trouble with neuropathy, like it and share it so we can get some information to them. Now, I'm going to go over the 7 factors, the 7 lifestyle factors that can help your body stop the degeneration and start the regeneration. Now, at any times that you feel like you need professional help, what I would do is find a physician in your area that can help you that specifically treats peripheral neuropathy. So these 7 factors all need to be addressed. So with any chronic health problem, very rarely is it just one thing. Usually what happens is you have multiple factors that can overwhelm the body. And very commonly, these factors add up over time. So you can have mechanical pressure on a nerve to a certain point, but you don't necessarily feel the numb, burning feet. But all of a sudden, you start drinking too much alcohol, then it adds in. So think of each factor playing a role, and the more factors that you can eliminate, the better chances you're going to have to help your body stop the degenerative process and start the regen. So let's first start talking about nutrition. So a well-balanced diet is important. So I'm not going to get into the details on this video, but basically we want to avoid the grain, we want to avoid gluten, we want to avoid certain sugars. And the reason we want to minimize or eliminate gluten is that for many people, even though you don't have a full-blown celiac disease, but you can have an intolerance. And sometimes there's something called molecular mimicry, which means certain foods, particularly milk and wheat, your body can think of those as like nerve cells or myelin cells, and the body will attack it. So certain foods we're going to recommend you avoid, particularly milk, wheat, and sugar. If you can do that, get plenty of fruits and vegetables, get plenty of cold water fish. You want to get the essential fats, you want to get vitamin D, you want to get those B vitamins, okay? So egg yolks, cold water fish, fruits and vegetables, leafy greens. Those are the bright colored foods, lower inflammation. So think of chronic inflammation as it's irritating the nerves. And again, it doesn't happen overnight, but that's a good place to start. The other thing is you want to eliminate alcohol. You know, people get neuropathy just from alcohol alone. So eliminate the alcohol. The second thing we want to talk about is exercise. We want to move. Now I know it's hard. If your feet hurt, how can you exercise? So if your feet hurt so bad you can't walk, we got to start somewhere. So sometimes you can start a stationary bike, sometimes you can get a recumbent bike, but you need to start moving. We need to get blood to the area. So the general gist of what we do in our office, and I work with a group of probably about 500 or so doctors across the United States. Have a very similar program where we look at neuropathy from a structural, metabolic, and neurological point of view. Structurally, you can see these yellow nerves come from the lower back down to your feet. So if there's something pinching here, you have a disc bulge, a disc herniation, some types of pinched nerve, that can affect it, okay? So structurally, we're going to look at you. And then also, we want to drive blood to the area. And there's a lot of little things you can do. So you need to move, maybe several times a day you get on a recumbent bike. You need to try to increase blood flow to the nerves. Those nerves need blood. Bottom line, we need better nerve flow, better blood flow to help those nerves rehabilitate. Now, the next thing we're going to look at is stress management. We all know no matter what your problem is, when you're under chronic stress, everything's worse. Your memory's worse, your digestion's worse, your immune system's worse. Meditation, prayer, if you can walk, walking in the woods can help lower some of the stress effects. Many times if you do some deep breathing exercise, you inhale for a count of 3 to 5 seconds, you hold for a count of 3 to 5, and you exhale for a count of 3. That helps a lot. Many times if you can write down certain things that are stressing you out before you go to bed, that seems to clear your mind to make for restful sleep. So whatever you can do to minimize stress plays a role in all health problems, including neuropathy. Now, smoking. Obviously, if you smoke, do your best to quit. It's just affecting the circulation of your entire body. So we got to address that. We got to get blood to those areas. That's a constant theme. Everything that we do, from a nutrition, from exercise, from certain rehab equipment, we want to drive blood to the feet. Now we want to talk about foot care. So not only we talked about structurally how you can have a pinched nerve in the back affecting your feet, but you've got all these little nerves in your feet. Well, every step you take, we're kind of compressing them. So make sure your shoes are not cramming your feet together. So good solid shoes with a good arch support, maybe a little bit wider shoe would be beneficial for your feet. When your neuropathy's bad, you need more padding on your feet. So take care of your feet. Get a shoe that's got better support. So usually a more robust shoe, not a flimsy shoe, a good one that has an arch support can really be helpful. The other thing is you can do gentle massage. In fact, I could do a whole video on massaging of the feet. For most people, it feels tremendous because let's say the nerve is irritated, what they call a double crush, or you can have a triple crush. So think of like a stream of water. Well, it has a little dam at the top of the stream that blocks some of the flow, another dam halfway through that blocks more, and then a third dam by the time the very little water is getting to the end of the stream. So the same thing with the nerve supply going to your feet. So you could have a pinched nerve in your back you're not aware about. You could have some tight muscles in your calves, which the nerves pass through that play a role. Now your feet are compressed in a shoe. You might need to get a bigger shoe. You got tight muscles and scar tissue that are affecting the nerves. You could have some bone spurs and bunions that are growing on the nerves. So there's many factors. So again, massaging your feet, perhaps working on the alignment of the feet. There's certain devices out there now that can help and improve the alignment of the bunion. If you have severe foot problems, you might want to see a podiatrist. So again, massage, maybe icing your feet, stretching your feet, good arch supports, all those play a role at reducing those horrible symptoms. And again, I have neuropathy myself, so not only do I treat patients, I've been in practice for over 30 years, but myself I have neuropathy. And so I know if your feet are in bad shape, that first step in the morning can be terrible. But as your nerves start to heal, it starts feeling better. The next thing we want to talk about is weight management. Obviously that plays a huge role. So we need to address that. Obviously the more pressure on your feet creates a problem, but also chronic weight problems lead to more inflammation. More inflammation, it's like your body is attacking those nerves. Think of inflammation like termites. And those termites are eating away at those nerves. So avoid the gluten, avoid the grain, avoid the sugar, get the vegetables, get some healthy fruits, get some colorful fruits, get cold water like wild Alaskan salmon in your diet. Try to get grass-fed meat. So those are the factors that are going to help you. And then also trying to get your weight down. So again, if it hurts to walk, you might want to use some type of recumbent bike. Or maybe you could do some strength training in the gym with your upper body. As you build some muscle, your body burns more calories at rest. So do whatever you can to try losing weight. Try to focus on not just losing weight, but actually putting some muscle on the body, because your body then can start burning calories just doing nothing. Now, sleep and rest. Obviously, if your feet are burning, how can you sleep? And I know the bizarre thing is, because my feet have done this, you can go from hot, where you want to get all the covers off your feet, to cold, where your feet can't seem to get warm enough. So do what you got to do to help your body get better, more restful sleep. So that means turning off the TV, turning off the computer, maybe get some blue light glasses, perhaps making the room dark. All those things will play a huge role in helping your body stop the degeneration and start the regeneration. So again, let me summarize all the factors. One, we want to look at you structurally. Do you have a pinched nerve in the spine affecting your feet? Two, we want to look at you metabolically. We got to get your weight down. We got to get good nutrients in. We want to avoid the junk food, avoid the foods that create inflammation. We want to eliminate milk and grain and sugar. We want to get the alcohol out. And three, neurologically. Neurologically, we want to make sure the signals from the brain are getting to the feet. We want to rebuild those pathways. And then on the next few videos, I'll be talking about some home rehab equipment that, again, drives blood to the area and rebuilds the pathways. Now, please tell me what you've done. I always like to know, it's your turn now. What have you done with your neuropathy? What have you done to try to help yourself? I have many patients that tell me they've taken certain medication and it feels good temporarily, but as time goes on, they need more and more as their body adapts. Have you changed your diet? What have you seen with the neuropathy? Have you changed your footwear? So please, if you have neuropathy, tell me what you have done. Tell me what your results are, whether they've been good or bad. And if you know someone that wants to get rid of pain, avoid the numbness and burning, and get better balance and have a better physical capacity, that means more quality years so they can live stronger longer, do me a favor, like it and subscribe to this channel, and then share this video. If you want more information on what we do in this office, then please watch this next video. You're going to see Jean, her story, and you'll be amazed at what her life came about by following a simple program that addresses structural problems, metabolic, and neurologic. Please go watch this video.